Well, the weather in Ottawa is always changing, and that means that our little ones can be exposed to a number of different viruses. But how do you tell those apart, and what should you be looking out for? We've paged Dr. Paul this morning to find out more about 3 common illnesses. Good morning to you.
Good morning, good morning.
I love when you're on because I get to pick your brain about all the things that we're experiencing as parents.
Yes.
And I was telling him, like, oh, yep, all of these we've had.
That's right.
So there are some common viruses right now.
Yeah, there are some common viruses, a lot of them with rashes.
Okay.
Hard to tell the difference sometimes,
Right.
but there are some specific patterns that each one has.
Okay.
Bottom line is that most are not dangerous.
Okay.
And no treatment is required,
Okay.
except keeping the children comfortable.
Okay, let's talk about the first common illness,
Yeah.
roseola.
So roseola really is caused by a virus, and the typical part about this, it usually occurs in younger babies, like less than
Okay.
2 years of age, mostly fall, spring. And the pattern is the baby has fever, no other symptoms.
Yeah, okay.
Is well otherwise for 3 or 4 days.
Yeah.
Fever goes down, parents are relieved, boom, all of a sudden a rash goes through the whole body. Very small, fine rash, not very dangerous, and that's how we can tell. Then
Okay.
a lot of times you go to the doctor, they examine the child,
Yeah.
it's roseola, and
Yeah.
it goes away. So that's one.
I remember our daughter Lola having
Yeah.
this, and it
Yeah.
was the same thing. Went to the doctor panicking, and right away they were able to tell us,
Yeah.
oh, this is roseola. You're
Yeah.
fine. It's okay.
Exactly.
All right, let's talk about the next one. Hand,
Yeah.
foot, mouth.
Yeah.
This is not a fun one.
That's not fun. That's, again, caused by another type of virus, called
Okay.
tachyviruses. Occurs more in the summer, but it can occur all year round. And it's like what it says, hand, foot, mouth.
Okay.
It's got rash on the feet. You got rash on the hands and rash around the mouth. You can get it around the mouth, on the tongue. And
Okay.
again, it's a matter of a diagnosis. It can be associated with vomiting and diarrhea as well.
Okay.
And so here you go. You got the rash
little
around the
spots,
mouth, and you can see
right.
it sort of in the tongue as well.
Right.
But that's kind of the telltale sign. If you've got
Yeah.
lesions there, that's what it is. And again, it goes away on its own. Children may be uncomfortable. Again, if they have diarrhea or vomiting, make sure they're rehydrated. And one other thing I want to say before we go to the next one:
Yeah.
if a child has fever, we can give Tylenol, acetaminophen, but never give children aspirin. I just want to say that.
Okay, good tip.
Yeah.
And this is one that parents can also get.
Yes, this
too,
is all
right?
ages. We see it
Yeah.
at all ages, but typically more in children. But again, same cause, same treatment, and it goes away on its own.
Okay, so if your child has it as a parent, just be careful because you can get it too.
Yes, it's
Not a fun
contagious.
one.
They're all contagious, all of
Yeah.
these.
And let's talk about fifth disease.
Yes, fifth disease. Some people call it, the medical term is erythema infectiosum,
Okay.
or slap face syndrome.
Yeah.
Basically, it's a rash that has a typical, almost slap somebody in the face. That's
Yeah,
why you
it
see the head
does. It
over
looks
there.
like the child got
Yes.
smacked in the cheeks.
Exactly. However, you have a rash all over the body as well. It's kind of a
Okay.
lacy rash. And it can last 5-10 days.
Okay.
And with this as well, it really isn't dangerous to children unless they have an underlying, blood disorder and so on. But it is, if a pregnant woman gets in contact with this,
Okay.
it may be a bit dangerous for the baby.
Okay.
And so they should consult their doctor if they've been in contact with it. Although most people have had it in their lives, so it's not going to be a big deal.
Okay.
Again, this goes away on its own, but this lasts a bit longer, typically 5 to 10 days.
So if a parent who has it who's pregnant, they should be cautious around
Yes.
their child with this
And if the
disease.
child has it, they should
Yeah.
be careful. But in most situations, like I said, mothers have already had it one time in their life, so they're protected.
Okay.
But again, in most situations, these go away, do not need any specific treatment.
Perfect. Well, thank you so much for joining us
pleasure.
today and breaking down all these fun viruses that, parents are dealing with this time of the year.
That's right.
We truly appreciate it.